Kate Birkenhead, Health Improvement Manager, NHS Hull. What we did in Hull is we did a pilot in the hospital trust.
Oh, right, okay.
Working on the cardiac and respiratory wards.
Right.
And we trained up the ward staff to undertake this work with the idea that the staff would refer patients to a variety of local services.
Yep.
Weight management, alcohol harm reduction and smoking cessation services. Initially the staff were very reticent about this.
Okay.
They didn't want to take part at all, but once we'd done the first training session they all wanted to put their names forward.
That's good.
And the reasons why they valued the training, well, they did value the training because it made them feel valued.
Of course.
And they built confidence. They did say before the training they lacked confidence in raising healthy lifestyle issues.
Yep.
So built confidence. They learnt about motivational interviewing, and also they had more confidence about the local services. So
Great.
it worked
So
really
it went
well.
right across the board then.
But before we did that, we had to get the approval and the backing of directors at the hospital trust. Now that took 4 to 5 months.
Okay.
But again, if we hadn't have got that, we
Yes.
wouldn't have been able to take this forward. We had to train up the staff, prove that the staff that were then referring the patients on to the local stop smoking, weight management, alcohol harm reduction services, and then get the feedback, were they attending the services when they left hospital? And we found out they are. Because what we've had to do, the training initially was a day,
Yep.
and we've cut it right down
Yes.
to at the most 2 hours, but sometimes hour slots over
Right, okay.
lunchtime
Okay.
on the wards itself.
Yeah.
Because again, that was one of the issues with the managers and the directors. It would take too much time, the staff too much time. We've tried e-learning, it didn't work. They weren't interested in that, but they were interested in the hour-long sessions on the ward. What we'd like to do in Hull is to take it out into the community, and we are skilling up those members of the public who've been trained on the Altogether Better Healthwise Champion programme.
Okay.
So they've had some background in health and the importance of making healthy lifestyles, but we're going to train them in this approach so they can work with their friends, their family,
Okay.
and other people they meet in the community. Another way we're using it is with the Hull City Council and the children's services.
Right.
So the staff that work with children are being trained in this approach.
Okay.
And again, it's about raising relevant issues and referring on to other services.
Yes. Yeah.
That's again and it's going to be captured. We did go to the local authority and they said the children's services is our pilot.
Fine.
But I'm sure if we offered it to the adult services,
Yes.
they'd say yes as well. But again, it's just
step-by-step
yes,
approach.
it is.
to it.
Yeah, I think one organisation that we should work with is the local Mental Health Foundation Trust.
Right.
So we've started conversations with them, about the approach there, and I think that'll be a challenge. But I'd really like to see it in that organisation, because sometimes the physical health of mental health clients can be forgotten.